Yeah. So it's recording now, and I'm going to share the screen for anorexia nervosa. You can open up the presentation that I posted yesterday into the group. Uh, can you all see my screen?
Yes.
Okay. So basically, to record this session, I'm running two gadgets here. From one gadget, I'm speaking, and from one gadget, I'm sharing the screen. So it's kind of distracted. Just let me settle these issues, and then I will start. Yes. Okay. So we did everything related to psychiatry. Either it was mini mental state examination and depression and psychosis. We were left with one very difficult station. I told you that anorexia nervosa station. If we talk about it, that why difficult, it's not about the management that is difficult. Sometimes it could be challenging for you to stimulate the station with the patient, like what questions need to be asked. And there's a great chance that you may miss a lot of questions while doing the anorexia nervosa, because anorexia nervosa demands something apart from MC Shitfam and OD paras and past medical history and everything. This station demands from you to ask a lot of questions regarding the eating habits of the patient. So many candidates either emphasize so much on eating habits that they don't ask other questions. And sometimes candidates emphasize on so much on MC Shitfam and Maftosa part, like the past medical and how is the mood and all. And they don't ask much questions about the eating habits. But we need to find a balance in between so that you make sure that you're going to pass this station. And it's also difficult to do anorexia nervosa because that lady, that teenager girl who is going to present will not be very cooperative with you. So that's why it could be tough for you. Sometimes, the parents will be in the picture in the scenario. That makes it a bit easy because now they know and they want your help. And sometimes that girl will be presented to medicine ward with something wrong with her tummy or or electrolytes imbalance, and then medicine doctors suspected that she's having this psychiatric illness, it's anorexia nervosa, and they made a call, they wrote a call to you, and it's like of an interdepartmental call referral, and you are going there and you have to do a psychiatric evaluation. So I think I made it really clear that how in how many situations this scenario can come, either with the patients, either with the parents, either with girl presented herself with some kind of illness of tummy, or or she got admitted with electrolyte imbalance, and it's an interdepartmental call. So first you identified that it's a psychiatric station, and then you identified uh, that it's anorexia nervosa. Two things are clear now. The third challenge for you that will be waiting for you in the cubicle is going to be to convince that girl to open up about the things. So basically you cannot throw questions at her face like directly, like, I'm here for the evaluation of anorexia nervosa and let me ask you a few questions. That won't be the way. It should sound natural, that you are just a doctor who just entered randomly and asking overall questions about the general health, and then you got to know while asking those questions that, yes, there's some problem with the appetite of patient. That's why now you are digging into the situation. So try to keep it more natural so that patient can open up. Direct enforcement of the questions and, asking her about anorexia nervosa will make her confused or angry, and she won't open up easily. So if we talk about how to do that, I have written it open questions, right? These are the questions which don't have the answers in yes or no. Yes or no could be dangerous in anorexia nervosa. Try to ask questions which have, the answer should have all the description, like what she's thinking, what is her thought process, and why she's doing that, and everything like that. And now I know that these are so many questions, and it's not possible practically to remember all of these questions, but at least when you're reading so many questions, at least you can memorize 4 or 5, or you can recall at that point at least 4 to 5 questions from here. And you can choose those questions and you can cram that up. But starting from the very start, when patient presented and you started a conversation, then how to sound natural. So you will tell like this: hello, this is Dr. Ghazal Matloob, and I'm here to talk to you about few things, as I know that you're not doing really well health-wise. So that's why I need to ask you questions so that we can be sure that what's going on. Can you tell me that how is your health recently, and can you tell me that why you presented to the hospital at the very first place? So like this, and then the complaint that that person, that girl is telling you that, I presented with diarrhea, or I presented with lethargy, or I presented because I couldn't walk, something like that. So you will do the OD para. You will say, I see. Okay, can you tell me more about it? How it started? Was there any trigger factor? Was there anything that you tried to make it better? And did it, get it did it get better? And what were you doing when you first noticed? Like those questions, very basic questions. Now, after that, you will say, okay, can you tell me that have any fever? Do the history. Try to be natural. Don't show her that and you just have assumed everything, and now you are being judgmental and you're just asking all those questions that are only related to anorexia. So say, okay, you tell me, like, do you feel dizzy? Do you feel short of breath? And sometimes, by any chance, did you fall? Or like, do you think that you're losing so much weight recently? Do you think that how your appetite has increased, or your appetite has decreased? Are there any lumps and bumps in the body? So try to keep it natural. Ask those questions, and you will get the idea there by asking these flaws question. For the beginners who don't know that what is flaws are the questions that are asked to rule out the red flags. F is for fever, L is for the lumps and bumps in the body, A is for the anorexia, and W is for the weight, and S is for the sweating, a night sweats basically. So you will be asking like all these questions. She will say that, no, I don't feel much hungry, or like I don't eat much, and you will ask about that how's your weight, and she will say I'm losing weight. And then you will ask, okay, I need to know about your personal habits as well. Do you work out? So it's a question that sounds very natural, that you're a doctor and you're just asking if she is living a healthy lifestyle. But this is the time when you will identify, and she will tell you that she works out 5 to 6 times a day, or 3 times a day. She goes to the gym 3 times in a day, and she works out for like long sessions, 1 to 2 hours. So you will get to know more about it, that house where this anorexia nervosa is, what stage it is. And so that you can formulate your management plan accordingly by assessing the severity. So once you're done with this question, and now you're sure, then you will ask these questions that are showing on my screen, that how was the previous weight and how much did you lose, and over how long, and was this intentional weight loss or is it an unintentional weight loss? You need to ask all these questions. Do not miss any questions. Just, when she's saying I lost weight, don't many candidates made this mistake. They say okay, and sometimes maybe they ask another question, how much, but you should ask over how much span you lost this weight, and was it intentional or unintentional? If it was intentional, what was the intention, and what were you doing to lose the weight? And then you should ask, okay, do you think that now you have got your ideal weight, or do you think you want to lose more weight? If so, how much more? It will give you a goal, it will give you an idea that what's the goal of this patient, what kind of weight you want to achieve. And then skip this question, how do you intend to lose this weight? Then you will ask that, have you noticed yourself avoiding junk food, fattening foods, or like basic diet, and maybe you are on only salads or something like that? And then ask about the periods. Every girl, every teenager who will have severe anorexia nervosa will be missing her periods, like she will be having amenorrheas. And ask what was the last date. That's it. Then pregnancy you can skip, sexual history you can skip. And then, do you see yourself thinking excessively about food? No, don't ask this question again. And then have you ever tried to make yourself sick? This is very important. It will confirm the diagnosis of anorexia nervosa. You should ask that, like, after eating, if she is inducing vomiting or not. uh, Inducing vomiting after doing a binge eating can actually make a differential diagnosis apart from anorexia nervosa. I will tell you that in the last week, I was seeing the recalls from the plab 2. In the last 4 to 5 days, that the exam which is coming, I have seen two exams maybe where I have seen at least three stations that were totally new. And it's very unusual or unlikely for the plab 2 administration or GMC and examiners. They don't change much the syllabus, but now they are changing it and they are introducing the new stations, and I'm working on them. I will definitely share those stations, and maybe I will add it into my revision course and do all of them. Because like cat scratch, I have seen it new, and there are a few ENT stations that will which I've seen. So there is a chance that you make your mind that I will enter it's only anorexia nervosa, but it could be bulimia nervosa. Okay, so it is an eating disorder, and it's a psychiatric disorder, but eating disorder is not only of one type. Is eating disorder has so many types. So anorexia nervosa, where person do not eat at all, and it's less likely that they induce vomiting. But in bulimia nervosa, the person will eat so much and like binge eating, and then they induce the vomiting in the fear of getting fat. So you have to identify and ask this question. That's why it's important. Then, have you ever taken medications to lose weight? It's important. Why it's important? I think you all have read one question in plab 1 where we used to there were kind of scenario where there is a pigmentation in the intestine while doing the colonoscopy, and what could be the reason for it? And the answer was that using excessive laxatives. So anorexia nervosa people do this. They take so much laxatives to induce diarrhea, to increase the basal metabolic rate of their body. So you should ask about this. So you should know that how much the tummy must be affected, or her GIT system is affected, and how much is the severity for this anorexia nervosa. And then, do you exercise regularly? This question I told you that you should ask, like, I want to know about your personal habits. Do you work out? Like that. And this is the question I was telling you for the bulimia nervosa. Do you binge eat, and how often and for how long? And you should add one question in with that, is that do you think there is a particular situation, or there is or when there is stress you binge eat? Apart from that, you are normal. It is also one of the eating disorders where people do not have any bad eating habit apart from the stress. When they have stress, they eat a lot, and this is also one of the eating disorders. Okay. Just give me 1 minute. Someone is asking to let him or her enter into the Zoom meeting. Okay. Can someone let me know that are we clear till now for the anorexia nervosa? Hey, can someone tell me? I
Yes,
didn't record.
doctor.
Okay, thank you. Dr. Sidra is asking for the recording from yesterday. I didn't record anything yesterday, but today I'm recording it and I will post it on my YouTube. Okay. So the history in very much detail for the anorexia nervosa and that at least rule out other disorders. Examiner know that you are not scripted. You are trying to rule out stress eating disorder, bulimia nervosa. Okay. Now coming to the part where you need to do the diagnosis and management. So after asking these questions, if you have the MC sheet fam like mental health questions and suicide risk kind of things, if you don't have time, at least ask one question for suicide and at least ask one question about family and friends so that you what if she has anyone around that you can involve in her process of quitting these bad eating habits. Okay. Now, so scenario. So now you need to make a BMI. Many candidates make this mistake because, like, we have this universal habit of saying in the diagnosis part, "I would like to do. I would like to check your vitals, and I would like to do your tummy examination, for example, and I would like to check you from head to toe." So we forgot to say BMI. You should always mention in anorexia nervosa about the BMI that I am going to figure out your BMI by checking your height and weight. So this will be the time that examiner will actually give you the finding. There are candidates who don't say this line, and examiner will never give you this finding. Examiner specifically asks from you. Examiner specifically asks from you, okay, what kind of examinations, doctor, you're looking for, and that's the time he is judging you that if you're going to say BMI or not. This is a very small matter, and this is a very small thing, but sometimes you can make a big blunder by forgetting this one. So if you do not have BMI, how can you proceed towards management for anorexia nervosa? So if you will say, examiner will tell you this is the BMI. Now you will formulate the management plan accordingly. For example, if the BMI is more than 17.5, this is the time, the BMI is not that much bad, and it's a slight degree of anorexia nervosa, and you can actually deal it while she stays at home with the parents or with the friends, and you can start the cognitive behavior therapy with the patient. So you will say, and if the BMI is between the 15 and 17.5, it will be that you have to make your decision clinically and the based on the factors. Less than 15, and she's depressed, so you should not let the patient go to the home. You should admit the patient because now she is at more risk of developing electrolyte imbalances and the suicidal behavior or depressive behavior. So according to the BMI, you will decide your or formulate your management. Again, many people go with the scripts and they say all those things that is written in the scripts rather than using the common sense that what is the demand in this patient specifically in the exam. So you will formulate the management plan accordingly. It will be you need what you will say. Um, I can see that you are struggling with the XYZ or Miss XYZ. I can see that you're struggling with your eating habits. And I know that you also realize that. And I understand being a doctor, it's not in your control. And how much you try, it becomes more depressive. That's why today I'm here to give you that support so that we help you to quit these eating habits together by being together in this. And I will involve a psychiatrist who will be doing all the counseling for you and who will be telling you the different ways, the effective ways by his experience. And actually, you can try them. And then I would like to involve your family or your friends, to whom whatever you're comfortable, we can involve that person, and he'll be or she will be with you during this whole process. Do you think that you can do it? So one question that I forgot to tell you is, during the history you should ask that what is a thought process behind not eating much. And that question you can ask is like, do you idealize someone? And may I know that why do you want to lose so much weight? Is there something, or is there any target to achieve by doing this? And many times the patient will answer you that, like, I want to look like uh, some actress who is so slim and everything like that. And or she will say that I have someone in my school and she is a cheerleader there, and everyone likes her, and I want to look like her and everything. So you have to answer them accordingly, and you need to tell that tell that girl that see, if you want to look like person, you can, but there is a fine line in between making making yourself sick and looking fragile and thin, and looking healthier and slim. And I can help you with that, in maintaining your weight, but at least eating healthy and doing workout in an optimum proportion. So you will generate these lines for her, so that she knows that you don't want you're not trying to make her, you just want her to maintain and maintain a healthy balance in between your body weight. And you can actually give her some other diet which will not make her weak, and she can uh, still she can be still slim. So like that, you will generate your management, but you will invest at least 1 or 2 minutes in saying all those lines. And you won't say that like everyone has their own body type and you cannot look like her. It is offensive, it is rude. Don't go for these kind of sentences, because again, it's a defensive approach. Rather than saying that, you can say that yes, definitely you can do that, and I know everyone want to look at their best, but I can help you with that. But what I want is, at least you are healthy, you're not developing any problems by doing these kind of crash diets. I think I'm clear. If anyone have any question, just let me know, and then quickly I will tell you some tips about the telephonic conversation. Did you have any questions regarding
Hello.
Yeah.
Hi, doctor. I just had. Hello, am I audible?
Yes, you are.
Hi, Dr. Ghazal. I had a few questions if you could answer. Like some people who come like with anorexia, sometimes it does happens that they might have a preceding eating disorder already. Like say, for example, they have bulimia along with anorexia. So they might have a normal BMI, or some anorexic patients earlier were, having a higher BMI and then they converted into anorexic patient. So their BMI might be high, but they are being anorexic for a very long period of time. So how do we approach those cases?
Okay. Okay, that's fine. First of all, doctor, you will not meet this kind of situation in your exam. I know that it's a, in the real world, it's a question, and we have seen so many patients. First of all, there is a slight chance that you will not meet this kind of patient. You will always have a patient who will have less BMI. But part two, if this is a case that you have seen this kind of patient whose BMI is normal or on the higher side I won't say, but yeah, on the normal side, and this again, you will send that patient home, and you will tell the patient, I can see that your BMI is slightly higher on the side, or it's normal, but you still want to, look more. You still want to lose more weight. I can see that, but that's what dietitians are there and for, and we will make an appointment with a diet consultant or nutritionist who will actually by seeing your basal metabolic rate and your habits and your daily lifestyle and your requirements for the energy consumption, and then she will formulate a chart and you will definitely lose the weight. But for that, you don't have to force yourself in eating less, or once or in the stress you do the binge eating. She will definitely formulate some things for you that will be the healthy snacks, and still you can eat them without the stress that you will gain the weight further. So you can formulate the management plan by involving a nutritionist, and you can involve the nutritionist even in the anorexia nervosa part, that she will formulate a diet plan for you apart from the psychiatrist. Is that clear to you, doctor?
Yes, doctor. Thank you. Thanks a lot. I had one more question. Like
Yes.
sometimes we, like you said, like patients are more than 17.5 BMI. We ask them to, go back home and we keep doing a follow up. So like, and we explain CVT to them and everything. So how do you want us
Yeah.
to formulate, like how explaining to patients what CVT is if they don't agree? Like, because they are usually people who won't agree to our suggestions and everything.
Yes, that's why I told you that you will take the family and friends history, because now you want them in the picture who will help you by being in this scenario. So you will say this, that I told you earlier, that you will say that, okay, I realize that you have eating habits, and I know that too, you realize yourself that, and there should be the times when you feel lethargic or you feel the weakness. Am I right? And the patient will always agree with you on this point. So you will say that, so we can nicely agree on one agenda, Mrs. XYZ, that uh, the diet plan or the daily lifestyle you're following is making you sick. Anyone you can choose from your family or friends you think might help you, and I can make a next appointment, and I can talk to them, and then we can involve a psychiatrist in this process, and your friend or your parents will help you, uh, that you don't back out from this situation, and you keep attending your all sessions regarding counseling and cognitive behavior therapy. And I will also be checking with you time to time to see if you are attending your sessions and all. It's all about the rapport that you are going to build with that girl. If during the whole scenario you have asked all the questions nicely, like I told you, in the management there is even 0% chance, like no chance that she won't agree to you. If your rapport building was not good, it's only that case when she will not agree to all of this.
Thank you, doctor. Thanks a lot.
Okay. Okay, so we have 5 minutes left. After that, meeting time will be out. I'm going to, um, yeah, and